Hi, this is your Houston chiropractor, Dr. Gregory Johnson again, and now we're going to do Hung, Daisy's husband, and this is his first spinal decompression as well. We've already analyzed his posture and determined that his head is translated to the left, and his pelvis and lower lumbar spine is translated to the right. So he's got a curvature going on in between all that. So take a deep breath through your nose, Hung. Keep your teeth together, let all your air out, and just relax. Good. So I did a straight vertical pull. Did you feel that go all the way down? Good. See, he did really well on that one too. That was his very first time. He's still kicking. All right. So now we're going to do a Palmer diversified cervical break. Okay, drop this in my hand. There you go. Now tilt left for me. There we go. Okay. See how we have that curve now in his neck? That's the way it's supposed to look there. By the way, this is the way everyone should sleep, is on their backs with their legs elevated like this. I recommend you use a couple of big double pillows and fold them up. We've had patients duct tape them together, and it makes enough height for their legs to prop up. If you were to go, let's come over here on your tummy now, honey. If you put a couple of your couch pillows under your lower legs, that'll probably lift them up enough. They want to be parallel with the floor. So Hung having some low back stuff too. We're checking his leg length, and now his left leg is about 1/4 of an inch shorter than his right down here. As we bring him up, it gets even, and that tightens up in your low back too, huh? Okay. Yep. See how his pelvis raised up there too. Now he has the same. You guys have the same pattern in your pelvic misalignment. Come here, straight. See how the left side here is wider looking than the right one? Mm-hmm. Yep. So he's got an asymmetrical pelvic distortion that we'll be adjusting. I'm adjusting his left SI joint first on the X-axis, Z and Y-axis. There we go. And remember, it's his left leg that was short. Now I'm on the sacrum, on the right side of the sacrum, and now the left side of the sacrum. Then we get right on L5, straight P to A, in the Z-axis, L3, L2, there we go. Excellent, and just breathe normal and exhale. Okay, I'm going to put your head down a little bit. Okay. Yeah, he's tied up in his upper back. Most of you who work on computers and sit all day will understand exactly what that feels like, to have that tight upper back from working on a computer all day long. So I'm putting my elbow right in his paraspinal muscles here and putting a deep, steady pressure into them, which will help relax those muscles. Gets the toxins out of there and resets the muscle spindles so that they can be the appropriate tone as opposed to hypertonic or hypotonic. Hypertonic means they're tighter than normal. You don't see too many hypotonic areas, especially in people that have spinal vertebral subluxations, misalignments. I see even worse up here as far as tightness, huh? In pain probably. Yep. Good. Now he's got a little bit of upper thoracic misalignment here to the left, so I'm contacting with my thumb right on T1. Then now I'm down at T2. There, okay. Alright, let's go ahead and turn you back on your back again. Okay, legs are even now. He's got his shoes off today too, so I'll go ahead and adjust his feet as well. Okay. There we go, good. And I should have felt that not only in your ankle, but all the way up, did you? I did, good. A lot of people think they can't stand this at first, but then it feels so good afterwards they don't mind. So, and see, we're going to adjust his pelvis anteriorly as well because of that rotation. Getting on the anterior superior iliac spine here. And now they're better, they're more even. Okay, good. Let's slide you all the way down where your legs are all hanging all the way over the table. There we go. Good. Now just lay back. And put your arms out like this. Kind of straight to the side. There you go. Good. What I'm going to do now is I'm going to adjust his acromioclavicular joints in his shoulders, as well as the sternoclavicular joint, which is right where the clavicle attaches to the sternum. And then I'm going to adjust his anterior ribs on this left side first, and then now over here on the right side. This will make it easier for him to stand with his shoulders up and square. Okay, let's sit you up face towards your knees. There we go. His shoulder's moving good. He's got just a little skip jump in the right side, but not much. Left side's moving very smoothly, except for that last little pop. Okay. Check your elbows. Excellent. You're on the computer quite a bit too, right? Yeah. Yeah. Okay. Yeah. Would you mind sharing with our YouTube viewers what brought you in? And
I actually looked for something, a chiropractor that did more with athletes, so I didn't have to explain tightness in certain areas, and I found Dr. Johnson.
Most sports chiropractors, or MDs for that matter, they're used to getting athletes back on the field quicker, so that's what we do with all of our patients. We treat them as if they're athletes, so we get them back in whatever game of life they're in. So if they're an executive or office worker or housewife or whatever. And so let's come over here and shoot you now. You have to excuse me, I was out last week with the upper respiratory infection myself. Let's have you flex forward and backwards. I'm a little short on breath today. Now neutral. Yeah, see that squared his shoulders up a little bit better. All right, take a look. See, you're not as far left. And this is much more even. So here's your homework. You're going to pull up with your traps, pull back with your rhomboids, foot of these guys like that. Then we're going to bring your head straight back in the Z-axis and translate you to the right, which is exactly opposite of your current configuration. You're going to adjust your atlas. There we go. Now relax. And let's do that same thing one more time. This should feel smoother to you, and it should also be centered. Yep, take a look now. That's much better. See how your hands are even now? Equal spacing here. So good. So that's the before and after. Look at the posture. This is your Houston chiropractor. We'll see you next time.